happy to be here. Feel really honored. And I also just want to thank everyone for being here. It's amazing to see this many people who really care about our young people and, show up to an online training and are here for this. So I really appreciate this. I'm Elena Petrobowski. I am the GLS Grant Manager at Office of School and Adolescent Health. Clary Miller is not with me today, but she is out doing work in the community and doing super important work. So just me today, not Clary, but she's here in spirit too. She does a lot of work with me. Can everyone see my screen? Can we give me thumbs up? Yep, awesome. Okay, perfect. So as Monica said, I have a lot of experience working with young people in New Mexico. I worked for 2 tribes and pueblos, running out of school time programs and grant programs. And I was also a community school coordinator at Washington Middle School. So I think as I set this whole presentation up, I see a lot of counselors here, and I am not a clinician. So you're gonna see this suicide prevention from a little bit. I'm gonna ask you to think about it a little bit differently today, but I hope you learned something. So before we start this conversation, my first ask is, if today is not your day, if you just had a rough night or you had some loss in your life and you think that this presentation is going to trigger something and just make you feel worse, please take care of yourself. It's going to be recorded. You can see me live at head to toe, but please take care of yourself. And if at any time, because we are discussing some pretty sensitive topics, if at any time you need to go do that, go take care of yourself, go get up, walk around. Also, New Mexico Crisis and Access Line is here, right? You can scan that QR code. You can get support from them by text or by calling them. So make sure to use that if you need to. So, or go talk to a friend or whoever, because I know these are some tough topics, and I talk about this stuff all the time, and there's still days that I don't want to, or I have a tough time. So just giving you that space. It is Suicide Prevention Month, so there's been a lot of kind of stuff going on, walks, and there is a governor's proclamation, so we just want to make sure that you all know that. Office of School and Adolescent Health has a lot of different ways for you to be involved. You'll see, actually, Monica, could you put our website too in the chat? It's trainmeosa.com. It has some ways to interact with us also, so. Okay, so my first ask of you today is put in the chat, on a scale of cat, how are you feeling today? I need to know, which cat are you? I think I am, I'm number 3 for sure. I'm definitely like a little, what's going on? There's all these people I'm presenting to. They came to see me, awesome, but So where are you guys at? Can you put it in the chat? Awesome. Lots of 3s. I see some 7s, 5s. Look, my cat actually wants to be involved in this presentation and has decided to sit on my lap right now. Thank you. Thank you, cat, for being involved in my life and deciding to get in on the cat meme. Cool. 1. I think most days I'm a number 8. I think that's kind of how I go through life, is number 8. But today, presenting, I'm in a little different space. So awesome. Thanks for that. Sharing that with us. So let me see here. Oh, I missed a slide. Okay. Or I put it in the wrong place. Okay, I put it in the wrong place. So I'm going to skip a little bit. So one of the reasons I asked you that is where you're at today, is that we're all in different spaces, right? And I'm going to ask you, I was thinking about on my walk today when I work with young people, and also I have a 13-year-old son, so I take him, he walks to middle school in the morning. I've heard a lot this year about how tough this year is for kids and parents and everyone. And I've also heard a lot of conversation about, oh my gosh, the kids are feral, right? There's like, they can't control themselves. And I just want to reframe, like, take this second at the beginning of this presentation and just think about how everyone's trying to do their best, right? And that that we all are. We're all some version of those cats, right? And we're all just doing our best to get through this. And yeah, so just kind of let's start there this morning. I know it's pretty early in the morning, but let's start with that assumption. So here's what we're going to do. I'm going to frame kind of the problem for us all. You all probably know it in a very unique way. If you're in a school, right, you know what your school, what's going on in your school, you know how your kiddos are, you know how your parents are, but I'm going to kind of frame it big picture. We're going to talk about kind of the guiding frameworks of DOH and how we approach behavioral and mental health in schools. And then we're going to talk about kind of some school challenges and talk about some resources. Okay, so here's what we do. So Clary and I are part of the mental behavioral health team in school and adolescent health. We try to provide resources. We do technical assistance. We go out into schools. We talk to people about behavioral health in schools, and we also fund several contractors that do work in their communities in terms of behavioral health for young people. This is a really busy slide. We also have school-based health centers, right? And we really have a focus on school-based health centers, making sure that we're getting behavioral health. We know that our young people are getting their primary care and their behavioral health care from school-based health centers. We know it's super important that we have those in our communities. Again, here's some things we do. We try to collaborate with different agencies. We work with PED on safe schools. We worked with PED on just general kind of keeping young people healthy and safe. So one of the big things that Clary and I do are statewide trainings in suicide prevention. This training that I'm doing today is not that certification training, right? That is a QPR gatekeeper training. I will put at the end of this program a QR code for registration. We're also going to be doing that official certification training at Head to Toe, the in-person one, and we do them all the time across the state. So these are all the states, and actually this is old. We have now trained in every single state, every single county, except for Union, and there's another one. Oh geez, I don't know, but we have trained in all but 2 counties in New Mexico. So we're getting out there, we're doing lots of trainings. If you want us to come to your community after this training, again, reach out to the website. We also know that training works. These trainings that we do that are evidence-based, they help people recognize the warning signs of suicide. They also make people more comfortable asking the suicide question, right? And they know how to get that person to resources. So these are super important trainings. We do them for everyone. These are not just, these are gatekeeper classes. So I'll talk a little bit more about that later, but it's like CPR. We do it for everyone. We do it for bus drivers. We do it for coaches. We do these trainings for really, you know, anyone who's interested in their communities, right? For churches. Okay, so we're going to start with building connections activity. So one of the things that we talk about here is self-care, and it's weird because I always present with Clary. So I'm going to say Clary's things for her today. And the thing that she always says about self-care is not aftercare, right? Self-care is something that you do every single day to take care of yourself, not after something bad happens, right? I also want to acknowledge, because I've experienced it myself, that those of you that are in schools or in anywhere working with young people, those young people experience trauma, you help them with their trauma, and you get that secondary trauma. So it's really important that you all take care of yourself. So if you could, we're going to send you to breakout rooms. You're going to do introductions, who you are and your pronouns, and what are your favorite types of self-care. Monica, can you help me out there?
Setting them up.
Awesome. Thank you. See you back here soon. Then after I do it, I feel better, right? Like, and I think that it's really important to role model, right? The things that, if we think is community and connection is important, if we say that out loud, then we need to do things and show up in ways that demonstrate that. And so doing things like, you know, small group activities and connecting activities is part of that, right? We need to connect with other people. And it's hard in this virtual world. Like, I'm struggling a little bit online with all the Zoom meetings still. So so that's one of the reasons that we do that. So here's where I kind of set the scene of the mental health needs of New Mexico's youth. And again, this is going to be data, and it's going to be data to kind of show what y'all are probably seeing every day. So you probably know all these things already. This is just going to be data to kind of show it. Oh, but before I get there, one of the things that we do is really to talk about suicide is to lead by example with our language, right? And we do that in a couple of ways. One way that we can do that is by sharing our pronouns, right? And so that's one way of leading by example. Another way is the words that we use around suicide. So completed, can you guys put in the chat? See, there we go. I'm just going to point out, you guys is something I'm trying not to do, but I still do it because I've been saying you guys for like 40 years. So, but I try to change my language. So one of the things is that we try to change our language about suicide. So can you put in the chat for me something that you may have completed recently, or that someone else has completed? What would you complete? An assignment? Yes. 30, yes, my black, okay, yes, iReady. My son just completed his iReady, right? So these are things that are completed. We don't want to associate suicide with positive connotations. Most of these things that we completed are positive. So we try not to use the word completed when talking about suicide. What about commit? What is something that, and not commit to, what is something that you, hopefully not, but something that someone has committed? Crimes, right? Crime. So the same way, we don't want to talk about suicide as a criminal act or something that you commit. What we want to say is died by suicide, right? And again, not the language police, right? There's still times I mess this up, but as people who want to destigmatize mental health, like I'm sure many of you do, and destigmatize talking about suicide, we want to try and change our own language and role model. So we say died by suicide. We also say that there's suicide loss survivor. So somebody who's lost somebody to suicide, and a suicide attempt survivor, focusing on the survivor and the hope for recovery. So that's just another thing I wanted to talk about quickly before we get started. So we're in a public health crisis. We all know this. There's a billion articles. I probably couldn't even read them all every day about how our young people are in crisis, right? We talk about chronic mental illness begins by age 24, including half by age 14. And many of our school-age children receive those services in school, right, for those crises. So we are in a state of crisis in this country. We know that the pandemic possibly exacerbated it. And we know that early identification helps young people, right? So if we're doing a good job if we identify them younger. So this is old data. So I'm gonna also say that the new YRS data, hopefully Dylan Pell is here somewhere. He's our state epidemiologist on YRS. So there will be new data on YRS coming out very, very shortly. And hopefully we can get you all that information. I know hopefully some of that will be at head to toe also. Look at all these kids that feel sad or hopeless. This is sad, right? This is our young people. We're talking about like 32%, 45% in Valencia County, 51% in Union County. This is, oh, Dylan is here, yay, okay. So he will he'll be here to help us answer questions on data. I'll kind of maybe pause after we talk about more data. He has a link to the most recent state of mental health report. So, but I just want to point out that we're in tough times right here. But the good news is, right, that I know that you all are making the difference. I know that every person here in this whole virtual room is working with young people. You are all important in at least one young person's life, right? So you're all making a difference, but we do have a serious problem. We also have some data that kind of breaks it down into different demographic groups, right? We can see, I always looked at this female and male. I don't know, this is what's interesting about data, and Dylan and I talk about this sometimes, is there's lots of different ways to interpret data, right? Is it that females really felt more sad or hopeless? Or is it that they're more willing to say that they felt sad or hopeless? Are they more willing to talk about it, right? So there's lots of factors. And as we talk about suicide, I also want to say that suicide is complicated, right? We're going to talk about all different things, and we're going to talk about different kinds of mental health and different kinds of protective factors. But it's a complicated problem, and it is a public health problem, but it's not an easy fix. So there's lots of things going into it. I do want to really point out here too that it is incredibly important to protect our LGBTQ youth. Look at that number and how much higher it is. And so another thing that I always talk about here, and I talk about in another place too, is one of the things that is a protective factor for young people is affinity groups, right? Being around young people that they can identify with. And this could be an affinity group like a gay straight student alliance. It could also be drama, right? Or music or band, right? But when young people find a group of people, when they find their people, this is a protective factor, and we should be working to encourage, as we talk about schools, one of the things that you can do in schools is create those opportunities for affinity groups. This is major depressive episodes. And again, we're going to tie this in with some of the things that we talk about later. But again, there's some clear differences, right, in female and male. And I would say also our Black youth too in New Mexico is not a very big numbers wise population, but clearly the data is showing in the last few years that this is a population that of extra concern, that there's some mental health struggles. And one of the other things I need to say here is it's not that you're part of the groups. It's that being part of that group makes it harder for you to live in this world, right? That the rest of the people around you, that there's racism, that there's sexism, that there's hate crimes. Those are the things, right? It's not just that you're LGBTQ or Black, right? It's the way the world treats you that creates that stress. Mental health diagnosis in hospitalized patients. So again, depressive disorders. This is 2019, this is pre-pandemic, right? So we're not sure, or we don't have the data quite yet. I know Dylan will have it soon on where we're at now, but you can also see the difference between females and males and kind of where we're at with mental health.
Hey, Alina, can we
Mhm.
pause and answer a couple of these
Yeah,
questions in the chat about the
yeah,
data?
if Dylan could help me answer those questions, that would be super helpful, especially about the Native Americans and why they weren't on that particular, let me see, I think it was this slide. And I don't know, I mean, I have the slide, but Dylan probably has the data.
Yeah, I can answer this. So there's a note on the slide, but this data is collected by the federal government, the Substance Abuse and Mental Health Service Administration. They do face-to-face interviews. And in this case, they did not conduct enough interviews with American Indian and Alaska Native youths to have reportable data for that category, or for Asian and Pacific Islander youth. We use a few different data sets. This one has a major limitation. They just don't conduct enough interviews to do a lot of good reportable data. And then there was a question about gender identity. I don't think you might have a slide in here about that, but it's also, there's a page about gender identity and the data we have on it for both youth and adults in the report I linked.
Thank you, Dylan. Super helpful because it's hard for me to keep all this stuff in my head all the time. Yeah, there's that link to the report. I think that's really one of the best things to look at to kind of get a picture of what's going on in our state. This chart, I think it's important because it's important to note an upward trend, right? It's not just that this is a problem and, oh, it's getting better, or, oh, it's staying the same. The point of this slide is that it's getting worse. Right? Something's going on with our young people and we need to do a better job. So here's attempted suicide. Yeah, Robert, I see your comment and I've had that experience working with tribes too. So I understand. And I also understand with data, especially with communities, certain communities that have not been treated well by the government, that the trust in government agencies is not that great. And so they may not want to participate in some activities, especially research activities. So attempted suicides in New Mexico, again, kind of broken down by race, ethnicity, and some other sexual orientation. Again, we can see our LGBTQ youth are at greater risk, right? Super important to, when we talk about risk factors and protective factors, what can we do? So we kind of talked about the first two bullet points here, but the last one here, New Mexico high school students who seriously considered suicide increased from 15.9 to 18.8 from 2009 to 2019. That goes along with that upward trend, right? And while we are working super hard to address this crisis, it is complex, right? And we need to keep working. So here, I want to point this out because this has come up recently. We are here to protect our young people, and that includes our LGBTQ young people. So they're under a lot of stress in our schools. And a lot of that is because of us as adults. I'm just going to put that straight out there. We need to do a better job creating safe spaces and making them feel welcome and accepted and preventing them from being bullied by other young people and other adults. So we have a problem here. So we can do better. Again, here is a little bit better looking at gender nonconforming folks, young people. And again, clearly how we're going about treating these kids in schools, we can do better. And I say this really as somebody who's worked with young people and who knows that I can always do better, right? Because we all can. And this is clearly a place where we can do better. Okay, so ACEs in New Mexico. ACEs are traumatic childhood events. Who knows what ACEs are? Can you raise your hand so I can see on screen? Okay, so we know what they are, right? They're traumatic childhood events, and we have the highest rate of children who have between 3 and 8 ACEs in the country. You know, like a lot of things, New Mexico is kind of at the bottom of that list. And toxic stress can lead to long-term physical and mental health concerns. I want to put in a caveat about ACEs here that ACEs is not about an individual child. So I will use, talk about my own child as an example. My kiddo has a dad who's an alcoholic, right? And has had a couple of ACEs because of that, right? That does not necessarily mean that my child is at higher risk as an individual, right? There are also protective factors with ACEs. And you know what? You and I are all that protective factor, right? One person that a young person can talk to is a protective factor for ACEs. So I think it's really important to not talk about ACEs as this child is doomed, all of these bad things has happened to them, right? It's not about that one child, it's about groups. Like ACEs is like BMI, right? Like your BMI, football players can have this super high BMI and be really fit, right? And not be at risk for anything. It's just this number, right? So I think as we talk about ACEs, I'm very careful to talk about it as not like, oh, this child is going to have a terrible life because they have a bunch of ACEs, but that there's some protective factors and there's some risk factors, and these ACEs are just another risk factor. So this is overall suicide in New Mexico. The other thing that we talk about here is that suicide data is often farther behind other data just because of the way it's reported, right? And that it takes a while, and that it has to be a confirmed suicide, and that's a complicated factor, and that it's just always even federal data is several years behind in suicide data. Again, upward trend, this is general suicides, not just young people. So I'm probably preaching to the choir here, right? Honestly, a few years ago, we really needed these slides because people would be like, oh my God, suicide's not a problem here, whatever. I think now, post-pandemic world, it's a little bit different of a world. Mental health is kind of more on people's radar and not in their minds. And so so these slides, you all know this already. I think this is important to look at here. This is the number of youth suicides. So this is actual numbers. So Bernalillo County here is the highest county, of course, because we have the most number of young people, right? It's also important to point out on this slide that there are counties that are not reporting. It's not that there was no youth suicide in those counties. It's that those counties don't report. And that's about stigma, right? And destigmatization. And they want to live in denial and think that young people aren't committing suicide or aren't dying by suicide in those counties, but they are. I like this slide because we don't know the answer to it, and it makes me think. So you can see the dips in suicide ideation in emergency rooms in the summer. And I think it's interesting to think about why that may be. We don't know. Like I can't just like call up Dylan and say, hey Dylan, why does this happen? He doesn't know. We can interpret the data, right? But I like to think about how, let's make schools, like where's the potential for hope and growth? And the way I see it is, how can we make schools better places for young people, right? Not all of our kids feel safe in school. And we need to look out for those young people too, right? Some of our kids feel like they're safe, they belong, they love school, right? They're on sports teams, it's awesome. But there's some young people that don't want to go to school, right? I'm going to present at an attendance conference in a few weeks, and there's some middle schoolers who refuse to go to school, right? Because they're so unhappy there. So let's talk about how can we make schools better places for young people. These are our emergency department visits, and this is 2020. So this is some pandemic data here, right? Looks like we're making a difference, and some of the data in the last few years, I'm hoping shows that all of our work and training and all that we're doing across the state is making a difference. So, and also I know that so I want to say too, as we talk about the pandemic, it's really important to acknowledge that some young people really struggled during the pandemic. They really wanted to go back to school. My child was one of them, just felt really disconnected from school, just had a tough time. But I do know some young people that thrived during the pandemic, right? That did better in online classes, that like reconnected academically, just, they just did better when they worked from home. So, yeah. So just kind of think about that kids and young people aren't all the same either. So mental health indicators among youth is, again, this is that like upward trend, right? Things do not seem to be getting better. And 1 in 10 students attempted suicide in the past year. Okay, so I'm going to send you out to breakout rooms. And I think, what do you all talk among yourselves? Maybe see if you can come back with your top 3 biggest mental health challenges for our young people. Monica, if you could give 10 minutes for this, I would appreciate it. Because I want to hear from you all, and be ready to put it in the chat or talk about it too. Because I'd like to kind of hear what's going on. I have a lot to learn from you all too, so.
Yeah, you're lagging quite a
How to
bit.
fix that.
Your video, at least.
Yeah, let me. Social media. I'm gonna. I'm going to try that and see if it helps. Lack of access to resources for kids and families. Students unable to interact with each other. Coping skills. Impact of social media and technology. I know that's interesting, just in terms of how can we find solutions, right, to some of these problems. Coping skills. Anxiety.
I noticed that oh, can you guys hear me? I'm sorry. I'm just gonna say it. I noticed that a lot of the comments, and correct me if I'm wrong, have a lot of the challenges, but no solutions. Like I don't see a lot of solutions. And so we focused more on the solutions in our group rather than the challenges. I don't know if I can interrupt that. I apologize. But so we were just talking about like being able to find the kids to helping them to fit in, because that can affect, being in school, not being able to fit in, trying to find a place. And so being able to help them recognize how they can fit in, and being able to find out learning styles, because that can just be disrupting in school too. Different learning styles and losing interest in those type of things. And then the other one was being able to find, I lost the other one, sorry. There was three main topics. But
no, thank you. I appreciate you pointing out some solutions. I was noticing too, using anonymous reporting. I would say there was a group that talked about not enough activities for young people, and clearly one of the solutions is more activities for young people, right? So anyone else want to add anything?
Yeah, the third thing that we were talking about in the group, you have to excuse me, I'm at McDonald's, so there may be some noise in the background, so I apologize for that. But one of the things that we're talking about also is helping students identify their gifts, what I call gifts, but their talents. Sometimes there's a lot of focus on academics, but a lot of kids may not do well academically, but there are other things that they are extremely good at. And so it's helping them to be able to figure what those things are and help them to be able to identify that and how that can be useful for them.
Thanks, Larry. That's actually something I'm going to talk about soon. So Monica, how's my video and audio? Can y'all hear me and see me? I feel like I'm slow, but I don't know how to fix it.
Your audio's good. Your video's a little laggy, but your audio's fine.
Okay, so maybe if I stop video for a while, that will help. Okay, so I apologize, but that's what I'm going to do, or not, or it's not going to let me. Okay, so thank you, Larry, because that is something I'm going to say soon. So moving on a little bit, thank you everyone for participating in that. I think it's super important to hear what's going on out in your worlds and your experience. So I show this slide about heart disease. I show it in every single training that we do. And I show this slide about heart disease for a couple of reasons. One is I want suicide prevention, and I think the goal of suicide prevention is that we talk about suicide like we talk about heart disease. It's something that there are risk factors for, right? High blood pressure is a risk factor for heart disease. And you can do things about high blood pressure, right? You can exercise more, you can, do better on your diet, you can take medication. We don't judge the things that you can do to help yourself related to heart disease, right? We just know that there's risk factors and people can make changes in their lives, and some risk factors you can change, right? Some are about diet and exercise, and some are about genetics, right? But we don't judge people for their risk factors for heart disease. They're just facts. So that's one of the reasons. The other thing is that the training that we do, which is called QPR, and you'll see at the end the link to that, you'll see that it's like a CPR training. QPR, the way we teach it is it's a life-saving technique in a very short term, right? So like if you do QPR and you're asking a person about suicide and you're trying to help them and trying to get them to help, you're not doing open heart surgery, right? So that's how it's like CPR. Like if you're doing CPR, you are just helping that person until they can get to professional help. and QPR is similar. And that's why it's like a training that we try to get to as many people as we can. So and really stigma, like we want to be able to talk about suicide like we talk about heart disease. It's just some people are more at risk and some people are less at risk, and we can do things to help, right? There's also that feeling of like hope, right? And positive action, right? The person themselves can do things about heart disease and do things to decrease their risk factors. And the people around them can be supportive, right? And talk to them about their risk factors and talk to them. No one's like, oh my gosh, I can't talk to you about your heart disease, right? So there's that stigma factor. So that's one of the things that we talk about with suicide, and how, and there's a public health approach to heart disease, right? We know that city sidewalks make it hard for people to walk, right? If there's not, like, if you're right next to traffic, right? There's all kinds of things that we can do to help with heart disease that we could do with suicide also. So that's kind of the approach there. Another thing we talk about is risk for suicide, right? And we talk about these things coming together, and this is from Thomas Joyner. And we talk about perceived burdensomeness. So can you put in the chat real quick, who might think that they are a burden on society? Like what kind of person think they might be a burden? Any ideas? Like just single parents, students in special ed, children, yes, people who are struggling with addictions. Yep. Elderly sometimes, right? Yes, people with chronic illness, yes. So if I say, Monica, you are not a burden at all, does that help Monica not feel like that? Probably not, right? Because it's perceived, right? It's how she feels on the inside. So even if you tell someone they're not a burden, they still may think they're a burden. What about belongingness? Are there folks that feel like that they don't belong? Who might feel like LGBTQ+, yes. I'm gonna say most middle schoolers, I feel like that's a tough age for belongingness, right? Having a 13-year-old myself, adolescents, yep. They just like, they haven't quite found their people yet, right? Or where they think they fit in. They don't feel like they fit in anywhere. So that's thwarted belongingness. Again, if I tell you, oh, you belong here, it's fine, right? It's again about that feeling, right? But also if there's really no place for you, right? If we're not welcoming people into our spaces, then we're adding to that. There's also acquired capacity for suicide. And this has several components, but one of them is access to lethal means, right? And access to lethal means and the ability to use lethal means, right? So who might have an acquired capacity for lethal means just because of their job? Like we're talking lethal means, guns, drugs, police officers, they have a gun, know how to use it. Same with military, yep. What about other types of lethal means? Nurses, medical, right? It's just a capacity. It's not a judgment, right? Some people just, because of their jobs or who they are or where they grew up, know how to use a gun. Parents that deal drugs, right? They know how to use drugs. They have it in their house, right? So that's that acquired capacity. So when all those things come together with a desire for suicide, right? So you can have all those things and still not have a desire for suicide. Maybe you have some cultural, religious protective factors, right? That just, you don't have that desire. But those three things plus the desire can raise that risk. Also, again, one of the things I think is really important, and one of the things that always makes me sad as we talk about all that data, right, is like how poorly New Mexico does on many of those data points, especially with young people, right? But you know what? Like, this is a freaking amazing state. I love living here, right? I moved here. I live here by choice. I'm really sad when people talk bad about New Mexico all the time. And I think that it's important to talk about all the wonderful things. Like, we can go outside here like year round. That's amazing, right? Like, that should be a plus in terms of our mental health, right? Sunshine. So with young people, we talk about protective factors and risk factors, right? Family and school connectedness, right? This is where you all in schools, y'all can really make a difference here, right? You can help make schools welcoming places, and help young people feel connected in those spaces. And I know you're doing it already, right? I know that the teacher that stands outside their room and knows all the kids and says their names during passing periods in a middle school is creating to connectedness, right? I also sadly know that there's times and spaces where I've been in where, you know, I'll use an example. I used to work for an after school program, and I had a boss who was a principal who said, the one thing that you can do is just greet kids as they get off the bus kindly and nicely and with a smile and welcome them. And it is absolutely true, right? And it's the same thing when kids walk into the school. If kids walk in, and I've seen it, and the principal is, oh my God, get that hoodie down. What is going on over there? Did you really wear that? Is that welcoming? Does that build connectedness? Right? And we're all doing our best, but let's think about let's be intentional about that best, especially when it comes to school connectedness and we're in a school. We really want those spaces to be welcoming and great places for young people to be. Reduced access to firearms. Again, not a judgment, not saying no one should own a gun, right? Again, self-reveal, I own a gun, but do I have it locked in a safe? Yes. Do I have ammunition? No, right? Can my child access that gun? Nope, because it's in a locked safe. So reduced access to firearms, right? So that's why gun locks, gun safes, and educating parents about that are super important things for us to do from a public health perspective. Safe schools, right? Lots of stuff going on in schools right now. It's a scary time for parents. Just had a conversation with my kiddo about the ALICE trainings and things that they're doing and where do they evacuate, right? Scary times, and that can also lead to increased anxiety, right? If you don't feel safe in school. Larry, here is where I always go give my same spiel that you always get, that you just gave about academic achievement, right? It's not just academic achievement, it's all kinds of achievement. It's drama. Am I a good actor? Am I a good artist? Am I, do I just have a lot of friends, right? A lot of times lately I've asked my kid what he likes about school, and he's like, I have a lot of friends, I'm doing good, right? So that's about self-esteem and not necessarily academic achievement, because we know not all our kids are academic achievers. And even sometimes when they are, that's not what they care about, right? That's not where they get their sense of purpose from. So those are all protective factors. You are all protective factors. If you have one kid that you are their person, like you're the teacher or the nurse or the counselor that kid comes to when they have a problem, right? Even if your personal life, your kids, your nieces, nephews, right? It only takes one adult to be a protective factor, right? That a kid can go to and not feel judged and feel like, someone can talk to them. Mental illness in terms of risk factors, right? I think it's also important to talk about risk factors. It's not like A plus B equals C, right? It's not like I have mental illness, so I automatically am suicidal, right? Like, that's not how it works. It's, again, complicated. Firearms in the household, right? Can young people access those firearms? And these are things that, like, when we're in schools, right? And this is what I say when we do our QPR trainings. These are things that, like, when you know that there's a previous suicide attempt, you want to keep an extra special eye on that kiddo, right? You know that that kiddo is at higher risk. There's also a training, sorry, my brain went backwards, about firearms called CALM, which is an access to lethal means training. You can do it online. There's a link to it on our website that is about talking to parents and people about access to lethal means in a very non-judgmental, very like, this is just a protective thing, right? So that's a training that's on our website if you're interested. I think it's super important that we start talking about this again. You know, access to firearms is linked to suicide. Exposure to
Karina?
yeah.
Oh, sorry.
Sorry.
Can Anna
Yeah,
unmute and ask a question?
sure, Anna. The link for Calm is on our website. Can you put the website link again in? Thanks, Monica.
Anna, you can ask your question, or if you prefer, you can put it in the chat and I can read it.
Okay. I'll come back to it then, Monica, at the end of this set of slides. Mental illness. Oh wait, we did that one. Where was I? Exposure to suicide. This is another risk factor that I think is important to mention to this audience. If you know a young person whose mother or father or sister or brother has died by suicide, that puts them at higher risk, right? When you're thinking about that young person that comes into your office or in distress or into your classroom, right? That's the young person to kind of keep a special eye on, right? Just thinking about those things. Okay, so here's where I'm going to ask you to flip your brain a little bit and talk and think about prevention, right? In a little bit different way maybe than you have before. So there's some things that we do in our office, that some frameworks that are evidence-based that we talk about. And one is the whole school, whole community, whole child model, right? And I know you all do this, like this is community schools. This is what some of you were talking about in terms of like risk factors and or in terms of what's going on, challenges. How do we get the community more involved in school? How do we get more activities for our young people, right? And that it's not just about academics, right? As Larry was talking about, that there's all these things going on in schools. Somebody said earlier, social emotional development is going on in schools, right? All of this learning is happening and that we should be supporting it all, right? So this whole child model in schools, that they're not this little academic achiever that is just there to get A's and get good scores on their standardized assessments. They have a lot more going on, right? Family engagement, I think, is another important aspect of this. How do we get families more involved in schools? It's a challenge, but I feel like it's an important thing to focus on. Okay, here's my meme that I feel like I needed to share because it spoke to me, right? So why don't the kids go outside anymore? The outside they built. Right? So I think the important thing here is there's this connection, right? It's like there's a clear connection between our environment and how we live, right? And so, and as I talk about prevention, like, how are you going to know? How is that young person who is an artist know that they're a really good artist and get self-esteem and get that achievement if there's no art class, right? So I think about thinking about this like big picture prevention is super important to me. And so this meme it makes me laugh and sad all at the same time, because like that's what it feels right. So this is a big, complicated, and since Monica's going to send out the slides, you probably can't see it. There's a lot going on here anyway. But this is kind of looking at prevention. Like I said, this is beyond, so that individual level that you can see right there, that's what a lot of you are doing in counseling, right? You are working with that individual young person. You are helping them be their best. You're helping them with coping mechanisms. You're helping them with leadership and life skills and their development, right? So that's that one-on-one piece. That's amazing work, super important. And yet there's all these other things, right? Like our environment, right? How often if we know that being outside is good for us psychologically, for our mental health, and it is, there's evidence, how do we get young people outside more, right? Does outside look like that picture, right? If they're in school all day, what part like, are they inside all day in school? How do we look at those big picture things that are related to mental health? And so I think this is a lot to think about. I think, yeah, so I wish one of the problems I have with this, so if you have your phones, can you take a picture of this? Because I'm going to send you into breakout rooms and I want you to talk about things, interventions, right, that you could do in different areas of this. Because I think we're doing a wonderful job for the most part on the is small. Okay, so let me just pick one in here. Let's pick communities. And I'm just going to give some examples of community interventions and put them in the chat. Oh, my video is getting slow again. So community interventions are, actually, I'll just tell them, housing instability, right? Is something that we could do as a community intervention. People are shaped by their environment. Social well-being is a public experience, not a private phenomenon, right? So that it's about how we all feel. Remember at the pandemic, like at the beginning, how it felt, how everyone just felt weird and off. I feel like everyone did. So that's one thing. So Monica, can you just send them to breakout rooms for 5 minutes? And as small as this is, try to come up with a couple of interventions that are not individual, that are positive things we could do, not the problems, but the intervention. 5 minutes, Monica?
Yep.
Thank you. Okay, as we come back, if you want to just put some of the things maybe in the chat that we talked about, I'm going to kind of skip through some of my slides and make sure that we're done on time. So if you can just put a couple things in the chat that you talked about, that would be great. We can just go forward from there. There we go. Reliable resources, yes. One of the things that we talk about a lot is making sure that that we've checked out our resources. Groups in the high school and elementary, I think affinity groups, affordable housing, yep. Resources in New Mexico, lack of mental health resources, absolutely. I would say that's one of the reasons our office focuses on school-based health centers, right? We know we can get those services to young people. Places where families and youth, right? Groups that reduce stigma, access to safe recreational events, societal level advocacy, lack of mental health services in small communities, more community-wide events. Awesome. Thank you so much for all those things. And I think again, I know a lot of you are doing the work in the schools, right? Doing that counseling, that individual work with young people and with families, right? but I hope we start thinking about how we can be supportive of more of all of these other areas, right, as we move forward. Okay, so I'm going to keep going. I'm going to skip through a bunch of slides, but you'll see them when Monica sends them out. I do want to also say that I think it's important to talk about racism as a public health crisis, especially in New Mexico, and especially with our young people. And just really, how do we think about this? I think this is a really great resource. You'll see it in the reference section if you want to learn more about it. And I will leave time for questions at the end. That's why I'm going to skip through some slides. So we do some other things. This is Preventing Suicide, a technical policy package. This is what we use. It talks a lot about the things that you just talked about: housing, connections in schools. Here at OSA, we also have some strategies that we use, right? We do QPR, which is the gatekeeper suicide prevention. We do youth mental health first aid, which is early intervention, right? That's those of you that are in schools, that's identifying young people that are in crisis and getting them to the help that they need right away. We also do H2T365 SHAPE, which is an assessment, which is free for schools, right? And we can provide some technical assistance on this that looks at your overall mental health services and everything, and making sure, seeing where you have strengths, seeing where you have weaknesses, doing an assessment, and that's a free service. And we can help you with that. It's free online too. You'll see the links. We use evidence-based practice, right? That means that there's some proof. We don't just pull things from thin air. There's some proof that those things work. Here's some links. You'll see those. And here's the SHAPE system. This is the assessment. If your school is interested, email me. I will put, actually, Monica, could you put my email in the chat? That would be super helpful. And then we also know that like all of this is connected, right? Like academics and mental health, it's all connected. So I know that, like, you know, principals who say to me, oh my gosh, we can't do SEL. We just need to focus on grades, right? Young people in distress have a tough time learning. Think about when you're in a not good headspace, how hard it would be for you to sit and learn. Okay, so we're gonna skip this. Thank you, Monica. Here's some of our resources. Again, here's New Mexico Crisis and Access Line. Here's our new 988 line. This is like 911, right? Hopefully you all know this. You can call anytime if there's a crisis. With this and New Mexico Crisis and Access Line, if you are with someone in crisis, you can call together. They can help you get connected to resources. I know when you're in a school setting, that you have a lot of resources there often, but sometimes when we're in our personal lives, we don't have all those things right at our fingertips. So that's important. I know you all do these things already, right? What can you do with a kid that you think is at risk? You can listen. We can just be there, be present with them, not look at our phones, not look at our computer. Make that space and time for young people, right? Know those risk factors and trust your gut. When you are worried about a kiddo, you're worried, trust your gut. Know your school policies and procedures ahead of time, before there's a crisis, right? I know that school safety plans often sit in a binder on a shelf, but it's important to know what we need to do. Stay with somebody who is in crisis. Whenever we do suicide prevention trainings, especially with school folks, we emphasize this 5 million times. It feels like we are beating it to death. But the reason we do this is because we know young people who have been left alone, right? In schools, in crisis. So make sure if this happens in your school, somebody stays with that young person. even following them to the bathroom, right? Know where your referrals are, right? New Mexico Crisis and Access Line, that's a good number one to have. Pulltogether.org, Emma just put, right? But know where those resources are and test out those resources, right? You can even call 988 just to make sure it works, or call New Mexico Crisis and Access Line just to double check. Also follow up, right? If you know that a young person is, and if you need resources, you can contact us too. We'll help you link. We can help you with that work. Follow up. One of the things that will forever stick with me is when I was a community school coordinator and had to sit with a young person who is having suicidal ideation in my office, just because I was the only person there to sit with them. Everyone else was busy. And, you know, I sat there until they needed to go, and they got their referral, and their guardians came and got them. But, you know, a week later, when I saw that young person in the hallway and asked them how they were, they were so excited that I remembered them. And yes, 988 works. It's always good to just call and just like New Mexico Crisis and Access Line and just be like, hey, just check it in. So follow up with young people. They appreciate it. Physical health and mental health should be treated the same, right? Here's our want to do more, right? We have those specific suicide prevention courses, their certifications, they're evidence-based. QPR is the one that we do. We know that there's other evidence-based suicide prevention programs that you may be using in your schools. But that is the one that we do. You can use this QR code, you can register for it. And it works. These courses work, right? It helps people, especially who do not talk about suicide very often, be more comfortable, be able to ask the suicide question. We know it works. There's our website again. And I'll go and do more. Like, I know that we talk about leaving with hope and with actions that we can do. And so I hope I made you at least think about some of those things today. I'm gonna see if my video is working and not too laggy, and I will open it up to questions.
We did have a few come in earlier. I'm going to read one of, sorry, I just had a brain fart.
That's
We can
okay.
go through those real quick.
Okay, sounds great.
Holly asked, what are options used in schools for anonymous reporting of students seeing other students doing drugs, alcohol, etc.?
There's a couple of options out there. I know that PED is working on a statewide anonymous reporting RFP right now. The experts that I know on anonymous reporting, I would say, are Palms and Associates, and they're the insurance company that works with the schools across the state. But I would say a statewide anonymous reporting system, it's on its way. And if you need more information, I will connect you to Palms, because they have know a lot more about it than I do. See something, say something. Yep, that's a pretty common. And Palms is free. Yes, they are free. So, okay.
The next one from Polly, what about non-suicidal self-injury?
Should also be taken super seriously, right? And any young person in mental health crisis, we're getting them the help they need. We're getting them referrals to counselors. Hopefully we have MOUs with providers, right, in our community that know our community. And yeah, it's also a huge problem out there. I know, working with young people.
Jennifer asked, do you have a good video for parents on suicide prevention that can be used by schools?
So one of the things with suicide prevention and is that we know, right? Like even speaking to this room, I know that many of you have probably been touched by suicide yourselves, right? You may have a loved one that died by suicide. And so we're super careful about showing just a video that could kind of trigger young people and put people in distress or anyone in distress, right? We're very careful about that. The way, even with QPR, we do train young people to do QPR, but we're just super careful because we don't want to put anyone in more distress, right, than we need to. We would never want to be the cause of problem. So yeah, so that's where it's at. We try not to do videos. I do think that you can send people to our QPR trainings. We do them virtually, we do them in person. And if you email me, I can send you some links to some other reliable sources. And yes, we do train parents. I see Rosa's questions. Yeah, we train everyone. We train anyone and everyone. It's supposed to be like CPR, right? Train as many people, because with you're in a room, one person who knows CPR can save a life. And the same thing with QPR.
The last one that came in earlier from Holly, where can a parent go for wraparound services for their entire family?
It depends on where you're at, your district. Again, I would say email me for more specifics and see if we can connect you specifically to someone in your community that has more information. It's hard to answer that just kind of generally.
Selena asked, what about awareness for adolescents?
For what? Sorry, I missed the last part of that question, Monica.
What about awareness for adolescents?
So many schools do a suicide prevention within their health curriculum, in both middle school and high school. It kind of depends on your school, what that curriculum is, or if you do it. I think that's definitely something that, if it isn't happening, should be, and that we can help you advocate for. So again, hard to know. I can tell you about APS because that's where my young person is, and they do have those things, but it's hard to know across the state, just because schools are so different. I see a question. What about elementary? Yes, elementary, and you can do suicide prevention, right, in elementary schools, right? But a lot of suicide prevention in elementary schools is the stuff I talked about. It isn't teaching young people directly about suicide. It's having those affinity groups. It's teaching coping mechanisms. It's doing the preventive aspects of this work, right? Anything else, Monica?
Just what's coming.
Hannah, I do see your question too about screeners. We use CSSRS. That's what we suggest to schools to use. And we do have some decision trees, hopefully, and we have a model policy that we can send out on suicide prevention in schools that includes some of those things. But again, I would say contact me directly for that information. I can get it out to you. Yes, and Michelle Katz also, we work with her and Project Aware. So any other questions?
I have
a few people did ask.
I'm sorry, I just had a question. There's a lot of, it sounds like a lot of resources and programs. Can we access all of those in one particular place?
A lot of it's on our website. I would
Okay.
say most of it, if not all of it. If there's anything specific, then reach out and I can see if I can connect you. Yep, there you go, Monica. Thank you.
And did you put your email in there again, or?
Yeah, I will put it in there I will put it in there again.
Okay, thanks.
And I hope to see you all. We are doing QPR at Head to Toe, the live one. So you can take that training now if you're interested. Again, we like to do QPR trainings. We think they're super important, and so please contact us for more of those. It's a 90-minute training, and that's one of the reasons we do it. We feel like it's super efficient and it gets the point across and is effective. Yep, thank you, Monique, for saying that.
Several people are just asking about the QPR registration.
Yeah,
I saw
yeah, it's both on the website and it'll go out in the slideshow. That QR code works for registration. And then the Head to Toe in person, you can just register through that. We're also doing youth mental health first aid in person pre-con for Head to Toe. And that's a super great training too. I did it several years ago. And I think it's more for non-mental, like non-clinicians, right? But it's really super good. It helps you talk to the young people about their mental health challenges. Thank you so much for everyone. I know it's 2 hours out of your day. I appreciate you being here. I know you are all doing good work in your communities and in your schools. Hi, Lila. It's so good to see you here, my Santa Ana folks that I don't get to see enough, that I miss. And have a wonderful day. Reach out to me seriously for anything. We are here to support you statewide. We're trying to get out there post-pandemic, be in person more, be more available. So yeah, thank you again.